Retrolisthesis, can you get rid of it? In this video, I'll be talking about what retrolisthesis is, what common symptoms of it are, how retrolisthesis affects your life, how to diagnose retrolisthesis, what the non-surgical approach to the treatment of retrolisthesis are, and how to manage your retrolisthesis at home. So first, we'll start with what is retrolisthesis. Retrolisthesis is when one of your vertebrae slips backward in relation to the vertebra below it. It can create pressure on the surrounding muscles, joints, and nerves, leading to discomfort and pain. It can be subtle compared to, let's say, disc herniation, but can lead to major pelvis instability without you even realizing. Crazy. So now, what are some of the causes of retrolisthesis? First of all, you can have trauma or injury to the spine causing retrolisthesis. You may be born with it. You can have degenerative changes as you age, but bear in mind, it doesn't have to be your age. It's the number of years that you can have, basically ignore the area, have dysfunctional patterns of movement that then lead to things like retrolisthesis, anterolisthesis, and other things. And finally, poor posture and lifestyle choices can definitely contribute to instability of the vertebra, causing issues. So now, what are some of the common symptoms of retrolisthesis? That would be a good one to know. You can have lower back pain, you can have stiffness in the area, you can have difficulty standing for long periods, or have reduced mobility. Some people even experience numbness or tingling in their legs if the condition is pressing on the close by nerves. So you can see there is a lot of things you can have that have the same symptoms, but then again, is it retrolisthesis or is it not? So let's now answer the question, how retrolisthesis affects your life. It can impact the most basic activities like sitting, standing, lifting, sleeping. It can impact the sports that you wish to play. For example, things like golfing or baseball, where there is a combination of flexion and rotation. The combination of those things typically irritate people with retrolisthesis. You can have chronic pain, which makes it hard to focus on work, and everyday tasks can become actually exhausting. It can cause degeneration of the spine to permanent nerve damage. So it can be from very basic to a lot more serious stuff. Now let's talk about the diagnosis of retrolisthesis. In my practice, I take the history, consultation, and examination very seriously to make sure that we're not basically missing anything, or we're not missing any extension of what that forward slip or backward slippage can have on the surrounding nerves and tissue. If I suspect there is retrolisthesis, then I order X-ray or MRI. MRI is not so needed unless I'm suspecting some nerve damage as well. Now let's talk about the non-surgical treatments of retrolisthesis. And the good news is, most cases, you don't even have to have surgery. This does not need to be a surgery by any means. It is so important to stabilize the spine and the pelvis in movement, which provides both stretching and strengthening of the areas together. In my opinion and in my practice, I use developmental movement exercises which combine both stretching and strengthening at the same time. These are what we all have done together, going from infant stage to the running toddler stage. In order to do them correctly, we end up stretching and strengthening the whole body, and that is the key. It is not like any of the exercises that you might have seen. The good news is, at the end of this video, I'll show you what those exercises look like. I then go over the common actions that cause you pain to see how to apply the principles of movement to your condition. For example, if you're a golfer with retrolisthesis, you need to learn how to dynamically move your body correctly and not to cause any issues on the area of weakness, which is the retrolisthesis area. Your body basically can't afford a mistake. These are all important because you must learn how to be, so that way going forward you can prevent yourself from committing the crime and actually hurting yourself. Now this takes us to my top 2 exercises that I do with my patients for retrolisthesis. But before I show you these exercises, please click the like button and comment if you found this video helpful, so that way YouTube bumps it up and more people can see it. Of course, you can contact me at any time if you have any questions. So now let's talk about retrolisthesis, top 2 exercises that I do with my patients. The first one is the functional bridge. That's different than the bridge that you may be used to doing. In this exercise, I'm going to go ahead and lay down. And I'm going to lay down with my spine being nice and flat against the floor. And the heels are about index finger away from my body. Now I bring my arms out at about 45 degrees. My neck is nicely elongated. I'm going to place my hand on my pubic area and the other one on my chest. And I'm going to lift my pelvis up using my back until the 2 hands are about leveled. At that point, I'm going to pretend a cannonball is going through my thighs, which is a cannon, and it's going to exit through my heels. So it's going to be going in that way. So it's the legs are pulling and my whole body is lifted up. At that point, I'm going to stabilize myself. Imagine my body's cut in 4 sections, 4 quadrants. And let's say I'm going to lift my right leg here, the one closest to the camera. I will then think about my opposite quadrants, the top and the bottom, really trying to go away from each other to really stretch the rectangle and press the top quadrant into the floor. And just as I'm about to lift my right leg closest to the camera, I'm going to really concentrate on my left upper quadrant and pressing it there. And at that point, I'm going to lift the leg up. Bring it down all the way. In this exercise, I want to make sure that I don't drop or rotate the pelvis, and I'm not using any part of my body any more than other areas. The whole body is supporting the exercise, and it is going to be super helpful with that. Now, for the next exercise, I'm going to need a yoga block. So hang on a second, let me go grab it. And for this, I'm going to lay down over my exercise ball, the yoga block. So it's going to touch just above my sacrum. So it's fully supported, my pelvis is supported, but my lower back is suspended in the air. Bend the knees. Of course, these exercises I do with my patients, and we're monitoring things. I'm monitoring the lower back spine to make sure that it is supporting itself as I move my legs around. So this is the one exercise I definitely recommend doing with your clinician who is rehabilitating you for your retrolisthesis. So in this exercise, I'm breathing biologically. This is something that I have gone over with my patients. We'll make sure we put biological breathing at the end of this video. And then I'm going to bring one leg up. In this case, I'm going to show you with my right hand that I'm gauging my lower back vertebra, and to make sure that I'm not using it. So I'm supporting my lower back as a result of the muscles of the lower back, and my breathing from the front, pressing onto my lower back spine from the front and inside of me as I'm moving my legs around. So I will first go to going away from the midline and coming close, going forward and backward, flexion and extension of the leg, and I'm gauging the muscles of my lower back and the whole vertebra in the spine, lower back spine, to make sure that I don't arch or I don't dip as a result of my leg movements. Of course, I do it on both sides, and this is so important because you have to understand your trunk has every ability to support itself. So just because I'm moving my legs does not mean that my lower back or my trunk needs to start moving. This is a movement that I have supported my pelvis with the block so it can fully be independent of my lower extremity moving. So retrolisthesis is not correctable, but we can certainly utilize the muscles correctly for support and stability. I hope that you found this video helpful. Please make sure, once again, you click the like button and you comment as to how this might have helped you. Thanks for watching.